right, so today I wanted to go through some blood work analysis so you can see how we approach blood work from a functional medicine perspective. So we'll actually be looking at my personal blood work today. For those of you that don't know, I was diagnosed with Lyme disease many years ago. I've had a journey with chronic health conditions, and recently some of my symptoms have kind of flared up again. So I was due to get some blood work done, so I wanted to run some blood work so I could see if there was anything that showed up that may indicate why I've had a little flare up of symptoms here. And so I figured I would run the report on that so I could share that with you guys and go through some education on how we approach blood work here. So I'll share the report with y'all here. So if you look here, this is the report that will run. If you sign up with us as a patient, we'll run your blood work through this report. This is a software called Optimal DX. So this gives us a full breakdown of all your numbers, plus at the end it'll give you assessments based on patterns in the blood work, shows us where there could be some dysfunction going on, some areas we could potentially need to address. This also goes through not just the standard ranges for blood work, but they have what's called their optimal or functional ranges. So the standard ranges on labs, if you go just look at the data from LabCorp Request or whoever, those are based on population averages, so not necessarily a healthy range. So by the time you're low or high on that range, there's probably already some significant dysfunction or disease processes going on. So what this does is it gives us not just the standard lab ranges, but what they consider to be an optimal or functional range. So if we're above or below optimal, that's not outside the normal range, but starting to show where there could be some dysfunction, some dysregulation starting, so we can address some issues before they get to be full-blown disease or some type of full-blown dysfunction there. So we'll go through the health report based on my personal blood work here, and I'll just kind of run through it with you. So this is the beginning of the report. Just talks about what's inside, kind of a table of contents here. You can see we have over 50 pages worth of information here, so you get a lot of good stuff from this. So first, just kind of an introduction. So this is just talking about what we talked about before, so the importance of blood testing, what we can learn about that, how the normal ranges are not necessarily optimal, the functional approach as opposed to the standard approach with blood work. Just explains the functional health report and just gives us a summary there. So this just talks about the practitioner report, again, goes through what we were talking about before. And here are the actual ranges, the actual numbers from the blood work, so we can analyze that. So it talks about blood test results. So if we look here at the top, this gives us a breakdown of how many numbers are in the optimal range. You can see how many are below and above optimal, so not necessarily the standard ranges, but just their functional optimal ranges based on the Optimal DX software. The number that are actually high or low according to the standard lab ranges, and alarm low and alarm high, so way too low or way too high. So you can see we have about 98 total markers on here. So I think this panel is similar to a type of panel that I would run on a patient, but there were a few things that I took away and added just based on things I've had issues with in the past and things I wanted to check and screen for on myself. But typically we'll have above 90, 100 markers in these panels. And if you were to run that through insurance, that would be probably over $1,500 worth of blood work. We can get that for typically between $250 and $300. So we get a lot of information from this. And you can see the breakdown here. So 58 of my numbers are in the optimal range, which is actually pretty good. So you can see there's definitely some things that are off, and we'll go through that. But having 58 of the numbers in the optimal range is good to see. All right, so we start out here with blood glucose markers. So you can see the first ones we have here are fasting glucose and hemoglobin A1C. So fasting glucose, you can see I'm just above the optimal range, well within the standard lab range, but I'm a little higher than what they consider to be optimal at 75 to 86. So that's a little higher than my glucose usually is on my blood work. There could be different reasons for that. Could be stress, or I didn't sleep well the night before. Something was different with my diet. That's just a snapshot in time. So a little above the optimal range, but not too bad. I wouldn't consider 88 to be too bad, but something I want to keep an eye on. Hemoglobin A1C, so that gives us more of a picture of how the glucose has been over the past 3 or 4 months. That's basically glucose combined with hemoglobin in a red blood cell during the normal lifespan of your red blood cells, which is around 120 days usually. So that's about a 4-month snapshot of where your blood glucose levels would be. You can see mine's really good. I'm in the optimal range, 5.1. That's good. Definitely don't want to see that getting above the 5.5, 5.7 range. That can start to indicate significant blood glucose dysregulation. But you can see here I'm in the optimal range, so that's good. So that makes me think overall, blood sugar is pretty good. That slightly high glucose is probably due to, something unusual like stress or a poor night's sleep or something like that. So this number down here, this EAG, this is estimated average glucose. That's one of the numbers they run that wasn't on the standard blood work that I ran. But it just gives kind of their average daily glucose over a 2 or so month period based on the hemoglobin A1C and the other blood sugar numbers. So you can see again, I'm in the optimal range there. So overall, over the past few months, it seems like my average blood glucose has been pretty good. Fasting insulin, you can see here. So insulin is the hormone secreted by the beta cells in your pancreas to help regulate blood sugar levels, get the blood sugar from the bloodstream into your cells. You can see mine's a little bit above optimal, just above optimal there at 5.3. I'd like to see that probably below 5, but right on the optimal range there. Again, it's a little higher than mine typically is. Last few times I've done blood work, that's been about 3. So for some reason, my blood sugar and insulin were a little bit high, higher than usual the day I got these labs drawn. You can see the optimal range is significantly different from the standard lab range. Optimal is considered to be between 2.6 and 5. According to a standard lab range, you wouldn't be high until you got to about 25. So definitely a big difference there. And that is something that I would like to see below 5 as an optimal range. But 5.3 is right on the edge there, not too bad. Okay. So these are some more numbers that they run. These are typically not included in the standard labs. These are averages and estimations based on some of the other numbers, the glucose and hemoglobin A1C, that kind of thing. So this first one here is basically estimating beta cell function. So we talked about the beta cells in the pancreas that produce insulin. So this is basically an estimation of beta cell function. And they're saying mine's a little below optimal there, not low, but below optimal based on their range. The cool thing with this report, you can click on these little green boxes here, and it'll take you down and give you an explanation of what that means if you're low or high and about that range. So again, this talks about an estimation of pancreatic beta cell function. Low would reflect decreased beta cell activity and diminished insulin output. So that's one of their little estimation numbers. This is another one here. This one is based on insulin sensitivity. So the higher this is, the more sensitive your cells are to insulin, which is good. If it's low, we're starting to see some potential insulin resistance, which is what you see in type 2 diabetes, that kind of thing, some blood sugar dysregulation there. But you can see mine's in the optimal range. So that's good, right there in the middle of the optimal range. So that's a good sign. This one here is another one of their estimations. This one is for insulin resistance. So if this was high, you would be more resistant to insulin, which is, we talked about, you don't want your cells to be resistant to insulin. That leads to prediabetes, type 2 diabetes, those blood sugar dysregulations. You can see mine's below optimal, but it's not high, which is good. If we click on that, we'll see what it says. So again, estimates the extent of insulin resistance. So what it says, if this is low, I can actually tend toward low blood sugar, so reactive hypoglycemia. So if I go too long without eating, it's just saying I could, end up with having issues with low blood sugar. So what that tells me is I probably, need to be careful about not going too long without eating something, because it appears, my blood sugar could get too low at that point. So I just need to kind of keep an eye on that. These are some other estimations. This is a marker for insulin resistance, one of their other percentages that they run. See, I'm in a good range there. Triglyceride glucose index is another one that they run based on my glucose, my fasting glucose, and my triglyceride numbers. Again, right there in the optimal range, so not worried about that. So that's good. So let's look at the kidney numbers here. So renal, this gives us some ideas of kidney function. So the first one here is BUN, that's blood urea nitrogen. So what that is, urea is a waste product in your body that's excreted by the kidneys. So if this number is high, that usually means there's a kidney issue. Dehydration could indicate something like low stomach acid. A high protein diet can also cause some of this, or increased protein breakdown in your body. So increased catabolism there. So That number is, a lot of times a kidney function number. So if that's high, we generally start to think kidney, but there's some other things like we were talking about, dehydration, that kind of thing can lead that to be high as well. You can see I'm just above the optimal range, and as we'll see with some of the other numbers, I'm not too worried about my kidney function. It appears to be good. So could be I was a little dehydrated or something, or just have, was eating a lot of protein the previous few days, something like that. So I'm not too worried about that. It's right there around the optimal range. Creatinine, so this can be a kidney marker as well. This is a product of muscle metabolism that's cleared through the kidneys. So if this is increased, that can indicate poor kidney function. Also prostate issues. So interestingly, if men have prostate issues, that can cause this to go up as well. Or if there's an infection like a UTI, that can also cause this number to go up. If it's low, a lot of times it's a sign of muscle atrophy. So you're breaking down too much muscle in your body. So if that number's low, that can indicate that. Creatine supplementation can also cause this to go high. So if you're taking creatine, that can also make this number look high. You can see I'm right there in the optimal range, so not too worried about that. Here's the BUN creatinine ratios. This is another ratio they typically run to assess things like kidney function. We can see what it says about this. So it's talking BUN, compares BUN to creatinine, providing insights into protein metabolism and renal function. So a lot of times, again, dehydration can cause this, cause that to be a little off. Kidney issues, increased protein breakdown, like a high protein diet. So again, those are the type of things we look at with those numbers. So if we look here, this eGFR, this is the filtration rate of the kidneys. This is how well your kidneys, basically kidney function, how well your kidneys are filtering out. So you can see mine is in the optimal range here between 90 and 120, which is good. Mine's at 112, so perfect. Kidneys are looking good there. All right. So prostate, so I did run a PSA level on myself. That's a prostate specific antigen. The reason I ran this is I do have a family history of prostate issues, and I'm pushing 40 here, so I wanted to check and make sure everything was good. So you can see my number 0.9 right there in the optimal range. Definitely wouldn't want to see that above, certainly not above 4. Their optimal range goes to about 2. If it was above 2, I might start to be feeling slightly concerned, but anything above 4 is certainly high. We don't want to see that. We also don't want to see big fluctuations one way or the other in the PSA number. That can be an indication that there's something going on. I also ran a free PSA and a free PSA percentage. Those weren't listed here, but those can also be important numbers to assess prostate function, see if there's an issue going on. Those were both normal too, so prostate's looking good, thankfully. Electrolytes. So this is going to measure electrolytes in your body, such as sodium, potassium, chloride. This can give us a lot of information on fluid, how well your body's maintaining fluid balance. Also adrenal function. So stress and adrenal function can cause, if you have issues with the adrenal dysfunction or stress, that can cause some of these numbers to be off as well. So that's one thing we look at here. Also hydration. So if there's a dehydration issue, a fluid balance issue, that can give us some information with this. So look here, first is sodium. So you can see I'm right there in the optimal range between 137 and 142. If this starts to go low or high, that's a lot of times an indicator of an adrenal issue, some kind of adrenal dysfunction, some kind of issue with that HPA axis, that hypothalamus pituitary adrenal axis, that has to do with the stress response and that kind of thing. So that can be an indicator of adrenal function. Potassium, you can see right there in the optimal range, so looking good with the electrolytes, the minerals here. Again, that can be something that can indicate an adrenal issue there. Chloride, the same thing. So a few things with chloride, you can see mine's in the optimal range of that at 103 there. That can indicate, if that's low, that can indicate an adrenal issue, some kind of adrenal dysfunction. Also low stomach acid, so hypochlorhydria. If that chloride can be low, if there's a low stomach acid issue. So there's some other numbers that we can look at different patterns and stuff that can give us an indication of why those numbers are off. You see, mine are all looking pretty good there. So far we're looking good. CO2, so this is carbon dioxide. So this a lot of times has to do with acid-base balance. So respiratory and kidney function would maintain that acid-base balance. See, I'm right on the edge there, right at the low end of the optimal range. So 25 is pretty good. I'm not worried about that, but that can again give us an indication if there is some kind of issue possibly with the kidneys or possibly respiration, anything that has to do with that acid-base balance. Sodium-potassium ratio, you can see right there perfectly in the middle of the optimal range, so that's good. All right, so here's some metabolic markers. Talk again about that acid-base balance. Anion gap, so this is actually a measurement of sodium and plus potassium, I believe, minus your chloride and CO2. I believe that's what that is. But basically it talks about acid-base balance. So if that's high, that could potentially indicate there's something going on with a little bit of acidosis. If it's low, a little bit of alkalosis going on. So let's check here and see. So yeah, it is sodium plus potassium minus CO2 plus chloride. High anion gap typically indicates net accumulation of acids. So a little bit of high acid, you can see I'm just above the optimal range, pretty close to optimal there, but that can be an issue with uncontrolled diabetes, kidney issues like renal failure, or some type of respiratory issue going on that's causing you to not be able to maintain acid-base balance. Mine's pretty good, not too high above the optimal range there. Uric acid, so this is usually considered with gout, so you see high uric acid with gout typically. Mine's right there at the top of the optimal range, pretty good, 5.3 is pretty good there. Uric acid can also indicate some other things, so vascular issues like atherosclerosis, arthritis, so uric acid will be high sometimes and build up in the joints and cause different types of arthritis. Kidney issues, oxidative stress, so a lot of free radical production and oxidative stress on the body can lead that to come up. It can also be a marker of intestinal permeability, so if we have a leaky gut type of issue, sometimes that can cause that uric acid to go up as well. So proteins, this gives us some information about the different proteins in the body, the proteins that are circulating in your blood. So total protein you can see here, low end of the optimal range, but 7's pretty good. It's right there in the optimal range, so that's good. It appears that I'm eating sufficient protein and breaking it down pretty well. So albumin here, this is one of the proteins in your blood. So a little gem here, if this is high, this is a significant indicator of dehydration. So if that albumin level is high, that's typically going to indicate dehydration. If it's low, there's several different things that could indicate. So we want to look at some other numbers to look at patterns and see what's going on there. But typically, if that's high, that the first thing we would look at would be dehydration there. Another thing with albumin is it's a carrier for calcium. So if albumin's high or low, that can affect your calcium levels. So if your calcium levels look to be a little bit off, always go look at the albumin to see if there's an issue there, and you may have to adjust that calcium level based on if there's an issue with albumin. Globulin is another protein. This one is typically associated with the immune system. So if you think about antibodies, so immunoglobulins, so if you know about like IgA, IgE, IgG, IgM, your different types of immunoglobulins, your antibodies there. This globulin is a component of that. So if we have issues with globulin, that's typically going to indicate something going on with the immune system. So for example, if it's low, that can be an indicator of inflammation in the digestive tract or some kind of immune insufficiency. If that's high, that can indicate a different, an overactive immune system, or we potentially start looking at some immune issues with that. Even in some cancers and things like that, that globulin can be off. So the albumin globulin ratio you can see is good. That's in the optimal range there. All right, so here's some more mineral markers. So we talked about calcium and how that can be influenced by albumin. You can see my calcium's good. It's in the nice range there, right in the middle of the optimal range. Phosphorus is another one here, another one of our minerals that we look at, looking good there, optimal range. Magnesium, so you can see I tested red blood cell magnesium as opposed to just a typical serum magnesium. I think the red blood cell test gives you a better idea of what's actually going on in the cell, especially with magnesium. You can see that's in the optimal range there, just above 6. So the magnesium's looking good. Copper and zinc here. So we want to make sure copper and zinc are in a particular ratio. You can see my copper is below optimal here. It's not below the standard range, but definitely in the below optimal range. So we can look and see what it says about that. It's vital for a lot of things: your body energy production, iron transport, neurotransmitters, antioxidants. So malabsorption, malnutrition, that can adversely affect the liver and brain. So again, mine's not super low, but it could probably come up a little bit there. Same thing with zinc. You can see not in the optimal range, certainly above the standard range, but kind of in that below optimal there. Zinc, another trace mineral that's very significant for a lot of things: immune system, tissue regeneration. Those are some of the things that zinc can help with, that your body needs zinc for. Low levels, so just zinc deficiency. So probably need to be supplementing with some more zinc, because I do eat a good number of high zinc foods. So that's probably something I might need to add in some supplementation for. So the copper zinc ratio, again, we talked about, so that's important. We want to maintain that in that optimal range, typically around 1, so between 0.7 and 1.5. We don't want that to get too far away from that 1-to-1 ratio. You can see mine's right there at 0.98. So even though the copper and zinc are both a little lower than I'd like to see them, at least the ratio is good. So I just need to work on getting a little bit more copper and zinc, and it could be a tissue absorption issue or something like that as well. So definitely I want to maintain that range, but get those numbers up a little bit. So here's the calcium to albumin ratio, which we talked about how those things are connected. Albumin is a carrier for calcium in the bloodstream. So you can see that's in the optimal range, which is good. Calcium to phosphorus ratio, that is also in the optimal range. So a lot of these ratios you wouldn't get on standard blood work. This is stuff that Optimal DX runs themselves. It can give us a lot of good information. So that's one positive, one cool thing about the Optimal DX software, is it runs all these extra numbers for you, these ratios and these ranges. All right, so liver and gallbladder. So let's talk a little bit about this. So alkaline phosphatase, here's the first number in the optimal range. That's good. If that starts to have issues, that can be an indicator of liver problems. Also some things, that can be an indicator of some bone issues, or some, several different things that alkaline phosphatase can indicate. You typically look at liver if that number's off, and compare that with some of the liver enzymes and things that can give you some more information about liver issues. But see, mine's good in the optimal range here. So we have the liver enzymes here, so see AST and ALT. So you can see my AST is above optimal. My ALT is actually high, like higher than even the standard range, which that's a little unusual for me. My liver enzymes typically aren't that high. So AST is not just a liver issue. If the AST were to be higher than the ALT, I would start to think something outside the liver. So AST can indicate a skeletal muscle issue, heart, kidney, even lungs sometimes. So that can indicate things outside of the liver. With the ALT here, this is more of a specific marker for the liver. So since that's higher than the AST, makes me think that's what's causing it's coming from the liver, not another issue outside of the liver there. Those numbers are definitely both higher than I would like to see them, especially this ALT here. So there's different things that can cause that. I mean, certainly liver disease, but I don't have any other really indications of something like, cirrhosis or hepatitis, or non-alcoholic fatty liver disease or something like that. Some other numbers would be off if that were the case. So this being high makes me think there's probably some kind of infection, like a reactivated infection, like a reactivated chronic infection, possibly a viral infection that could be causing those numbers to go up, which I kind of suspected I did have some kind of flare-up of some kind of previous infection going on. So this would certainly be an indicator of that, based on these numbers being high and some of the other liver and metabolic numbers being in a good range. Makes me kind of think, first of all, that there would be a chronic viral reactivation, or possibly a Lyme issue, but this would make me think more of a viral thing. Bilirubin, so this is something that circulates, is changed, goes through your bloodstream and goes to the liver and gallbladder. It's changed into water soluble, so it can be excreted from the body. You can see mine's high. It's always high. I have a genetic condition called Gilbert syndrome, or maybe it's Gilbert syndrome. But either way, that number's always high. I've actually seen it higher than that, so 1.5 isn't too bad, but that's a genetic thing for me. My dad has that as well. So GGT here, this is another liver enzyme. So this is in the optimal range. This is looking good there at 11. So GGT can go up if there's some kind of toxicity issue, so an environmental toxicity issue. Overconsumption of alcohol can cause that to go up. It can also go up if there's an issue with low glutathione levels. So glutathione is the body's main antioxidant, very important for detox processes and a lot of other things in the body. So you can see that if that number is high, that can indicate there's a potential toxicity issue with the liver. Mine's pretty good there at 11, so right there in the optimal range. So that definitely it's good to see that, because if that, I was being exposed to mold or something like that, that number could go up. If my glutathione stores and glutathione levels were low, that could be off. So thankfully that's in a good range, especially seeing the other two liver enzymes are being high. It's good to see that GGT in the optimal range. So you can see, even though the AST and ALT are both higher than I'd like to see them, you can see the range, the ratio there is pretty good. It's in the optimal range. So let's talk about iron markers here. So here's the iron markers. We have iron and ferritin, iron binding capacity here. So serum irons, this is just my iron level, a little below the optimal range, pretty close there, but maybe we'd like to see that a little bit higher, which is interesting because my ferritin, so this is the storage form of iron, this is how your body stores iron, that ferritin's actually above optimal, which ferritin is typically a good look at storage iron, but it can also go up in other situations too. So it can also go up with inflammation and oxidative stress issues. So it can be what's called an acute phase reactant. So if you have some inflammation going on in the body, or some type of stress, or some type of oxidative stress or an infection or something, that can shoot up. When I was in the middle of my Lyme issues and things, that got up to over 800 at one point because of the inflammation in my body, and I was freaking out. I didn't know if I had iron overload or something going on, but the iron levels have always been pretty good. So that number being that high made me think some kind of inflammation issue from the infection I was dealing with. So that's thankfully come down now. Again, that tends to be a little high on me still. I'd like to see that more in that optimal range. You can see at 45 to 79 there. 153 is better than it is a lot of times. Previously it was, I think last time I did blood work, I think it was above 200, but if that's high, something you can do with that, donate blood, even just once a year or something like that, that can make that come back down into a normal range pretty good. If that's low, that definitely makes us think there's a low iron issue, because there's low iron storage. So your body's going to do everything it can to maintain that iron level in the right range, but that can be at the expense of ferritin. So that can give us an idea of how much iron storage there is. So especially if that's low, that gives us an indication that we need more iron. So this is total iron binding capacity. So this is how much capacity your body has to, for iron to bind to receptors there. So mine's in the optimal range. If my iron levels were high, that might be low because I had less iron binding capacity because my iron was already high. If my iron was low, that number could shoot up since I have more binding sites for iron that aren't being used. UIBC, so another iron binding marker there, it's in the optimal range, so that's good. So is transferrin saturations. This is my iron saturation levels, again in the optimal range there, so glad to see that. Lipids, so this is your cholesterol levels. So if we look here, total cholesterol right at 200, so right at the level of what they would consider to be high. The high end of the optimal range is 199. 200 I'm actually not worried about at all as far as total cholesterol. Total cholesterol itself doesn't tell you a whole lot unless it's super high or super low generally. 200 is actually pretty good. Your body needs cholesterol for your brain, your cell membranes, making steroid hormones like testosterone. So 200 is a good range. I like to see that as far as the total cholesterol. Mine's typically between 180 and 200, so that's pretty good. That's toward the high end of where it usually is. Triglycerides here, definitely don't want those too high. They consider the optimal range to be 70 to 80. If it's a little lower than that, I wouldn't be too concerned. Mine is a little low there at 47. There's a few things they talk about when triglycerides are that low. It can be decrease in liver dysfunction, which we know I have some liver dysfunction going on based on the numbers we saw with the AST and ALT. So for whatever's causing that, probably some kind of reactivated infection. Diet deficient fat, so I eat plenty of healthy fats. I don't think that's it. And inflammatory processes. So again, there could be some kind of inflammatory process from an infection or something that could be affecting that number. 47 is not terrible, but I would like to see that a little bit higher. Certainly don't want to see it higher than that optimal range. LDL cholesterol, so that is high. Mine's typically between about 100 and 120, so I stay a little high with the LDL, but that's higher than it typically is. Again, LDL by itself doesn't necessarily make me concerned. If I did see somebody with a high LDL, I'd probably run a particle number test. So you can run a deeper test called like an NMR lipoprofile, or there's other ones as well that can tell you the actual number of particles. So cholesterol particles, LDL particles. There's different sizes as well. So you can have small, dense LDL particles, which are more dangerous to your blood vessels, and then you can have like some large, fluffy, a different type there that are less dangerous to your vascular system. So we can run that breakdown if we do start to see some cholesterol issues on the basic lipid panel here. You can run that lipoprofile test and see the actual particle numbers and get some more information on that. HDL cholesterol, generally considered the good cholesterol. Again, we won't go too much into that today, but there's a lot of nuances with that. But mine's good. It's a 68 in the optimal range there. Non-HDL cholesterol, so this is going to be the LDL plus the VLDL. You can see my VLDL is good. It's in the optimal range. Non-HDL cholesterol is considered high just because that LDL is high. So it may be interesting to run a particle number test on me at some point. I do have some family history of cholesterol issues and high particle numbers, so I probably at some point want to check into that, but these numbers don't concern me too much because the ratios here are all pretty good. So cholesterol to HDL ratio, 2.94, so that's in the optimal range. Anything above 3 is considered above optimal for them, and definitely don't want to see that above 4. I would say I definitely would like to see that below 4, so I'm good at 2.94 there. Triglyceride to HDL ratio, you can see that's also good there at 0.69. LDL to HDL ratio, again in the optimal range. So that makes me feel better about my LDL being a little high, is that all my ratios are good. But maybe something I want to look into at some point if that number doesn't come down some. So cardio and metabolic. So this is just one of their little estimations that they run based on your cardiovascular risk. Mine's in range. If anything, I'd rather that be low than high. But that's looking pretty good. We can read a little bit about what that says. It's a mathematical calculation based on your triglycerides and HDL. So that's good. It shows I have a reduced risk of cardiovascular disease. Abnormally low, it said, may indicate the triglyceride or HDL that was a little wonky there. So, but mine, you can see right there at the, we're in range and low meet there. So I'm pretty good with that. That would show generally that I have a reduced cardiovascular risk. That makes me feel good about that. So here's some thyroid numbers. So if we look through the thyroid, I ran a pretty good thyroid panel on this here. So TSH is this thyroid stimulating hormone. So this is going to stimulate this comes from the pituitary gland, going to stimulate your thyroid to make thyroid hormone. So you can see mine's 2.52, which is a little above their optimal range. Their optimal is between 1 and 2. I'm not too concerned about that. If it gets a lot above 2.5, I might start to worry about it. But 2.52, I'm not too worried about, just slightly above optimal. That started to creep up a little more. I might start to get a little bit interested in that. But I'm not too concerned about 2.5, so that's good. So that number typically, so a TSH number, thyroid stimulating hormone, if you were hypothyroid, you had low thyroid function, that number would typically be high. So your pituitary, your hypothalamus and your pituitary gland would be trying to stimulate your thyroid to make more thyroid hormone because your thyroid production was low. So in a hypothyroid issue, so with something typically like Hashimoto's or something like that, that number is typically going to be high. If you had hyperthyroidism, so something like Graves' disease, where you're making too much thyroid hormone, that number would be low because your hypothalamus and pituitary are not wanting to stimulate your thyroid to make any more thyroid hormones. So that can give us an indication of hypothyroid and hyperthyroid status. Now, there are some other issues where that may be different if you have an actual issue with your hypothalamus or pituitary gland, but that's rare. So typically in a hypothyroid situation, you would see that number high. In a hyperthyroid, you would see that number low. So you can see my total thyroid hormones here. So T4, you can see is in the optimal range, pretty good there. Free T4, so this is the free level of that T4 hormone. So you can see that's good as well in the optimal range. So if we look at T3, so this is the more active form of thyroid hormone, which your thyroid's going to produce more T4, and that's going to be converted to T3 in your body, the more active form. So you can see my total T3 is just into the optimal range there, kind of the low end of the optimal range. Same thing with the free T3, again in the optimal range, but towards the low end. Reverse T3, so this is something that gives us an idea of if there's some type of stress going on. This is kind of like the brakes. Your body's trying to put the brakes on your metabolism, so it'll convert T4 instead of converting it to the more active T3. It'll convert it to reverse T3 instead. Just kind of put the brakes on. That's typically because of some kind of stress. So if you see high cortisol levels, some type of infection, something that's causing stress on your body, that reverse T3 will often shoot up high. You can see mine's right there in the optimal range, so that's good. I was a little concerned that number would be high based on kind of some of the things I was feeling and some of the things I had going on, but that's good to see that number right there in the middle of the optimal range. Okay, this is a little interesting here. So these are thyroid antibodies here. You can see TPO, so thyroid peroxidase antibodies, and this is thyroglobulin antibodies. So this gives us an idea if there's antibodies, if your immune system's attacking your thyroid. So you would see this in something like Hashimoto's or Graves' disease, where you had those antibodies to your thyroid and your immune system was, basically had an autoimmune reaction going on against your thyroid. So I've never had an issue in the past from what I can remember with thyroid antibodies, but you can see my TPO antibodies are right here, almost high, definitely above optimal, and right there at the range that can be considered high. So if that was actually above 34, I could, that's basically an indication of Hashimoto's, whether you have the, thyroid, hypothyroid issues or not. That can be the beginning stages of Hashimoto's when you have those antibodies. So that's interesting. That's something I'm gonna have to keep an eye on because I've never had an issue with that before. Thyroglobulin antibodies, you can see, was 0, so nothing going on there. So that's definitely interesting. Free T3 to reverse T3 in the optimal range, so that was good. We saw that that reverse T3 was good, which I was pleasantly surprised by. Free T3 to free T4, so this can give us kind of an idea of how well your body is converting T4 into T3. So that happens in several different places in your body. So if that conversion's off, one thing that can actually indicate is a dysbiosis in the gut, so an issue with the gut microbiome. Because the normal bacteria in your gut actually have a big influence on converting that T4 to T3. So that's one thing that can indicate. There's other things as well that can cause that conversion to be off. A deficiency in something like selenium or zinc or something like that could affect that as well. You can see my conversion there is a little below optimal as far as that ratio goes. Not low, but pushing towards low. So that's something need to keep an eye on, is how well I'm converting T4 to T3. That's the thyroid there. So inflammation, here's a few inflammatory markers here. So C-reactive protein. So typically I would run what's considered called a high sensitivity, C-reactive protein, so an HSCRP. That gives you, it's an inflammatory marker. It can give you a little more indication of cardiovascular inflammation, also inflammation caused by issues with the diet and things like that. But my HSCRP is always, very low, always very much in a good range. So I wanted to run just a regular C-reactive protein, which is also an inflammatory marker, just to kind of see if there's a difference. You can see here, still well within the optimal range, very low at 0.9. So that's good to see. At least that inflammatory marker has pretty much always been good on me. So that's one good thing to see. Fibrinogen activity. So fibrinogen is a blood clotting protein. This can be an indicator of vascular inflammation. The reason I ran this is I've actually had this high before. So I just wanted to make sure we were good now. So ran that. And you can see in the optimal range, kind of towards the high end of the optimal range, but still good. Definitely a lot better than it used to be. So that number is good. So when that number is high, that can indicate an increased risk of cardiovascular disease, heart attack, stroke. It can also be elevated in some forms of cancer as well. So we definitely want to see that number within the normal range, because that can cause issues with blood vessels, even lead to, like we talked about, things like heart attack and stroke. So these are some of their ratios they run as well that can give us some ideas about inflammation. So neutrophil to lymphocyte ratio. So these are two types of white blood cells that we'll talk about here in a minute. You can see that ratio is actually above optimal, so indicates some potential inflammation there, having to do with the immune system. So that doesn't surprise me a little bit, considering I did suspect some type of chronic infection that's been reactivated. Platelet to lymphocyte ratio. Again, these are comparing a couple different types of blood cells. That ratio is definitely high. That's, even just in the high range, not even above optimal. So again, that's an indication of potential inflammation, generally based on some type of immune thing going on. So that makes me think that there is that chronic infection issue. We can click on that and see, it talks about these ratios here. Again, inflammation and clotting in your body. Inflammation there is pretty much the main thing. So definitely some inflammation going on, even though that C-reactive protein was good, which I'm happy to see that. But some of the other more immune types of inflammation there appears to be something going on there. So some vitamins here. So tested vitamin D in the optimal range. Definitely would like to see that above 50. So I'm slightly above 50 there, which is good. Their optimal range is 50 to 90. 90 might be a little high, but if it's above 50, I'm pretty happy with that. Certainly within the optimal range. Okay, so vitamin B12, you can see here, is very high. They even have that in the alarm high range with the little warning marker here. So you can see the optimal range for vitamin B12 is 545 to 1100. Mine is 1530. That's definitely really high. Mine's never been that high before. That would indicate probably there's an issue with tissue uptake with B12. So I have plenty of B12 in my bloodstream, but it's not getting into my tissues. So initially, the issue at the cellular level of not being able to get B12 into my cells at the tissue level. Be interesting to see what's causing that. That again could be some kind of viral, chronic viral issue affecting the cells or something else. So definitely something to keep an eye on there. I think that's probably related to whatever chronic infection thing I have going on. There's other things that can cause that, that B12 to go up just with weird things, liver damage, certain cancers, things like that. But the other markers on my blood work wouldn't really indicate that. So I'm thinking, just based on the patterns, that this has to do with whatever chronic infection situation I have going on. So that's something I'll definitely want to monitor and see if that changes. So sometimes when the B12 is low, you actually need to give people, or B12 is high, you actually need to give people more B12 because their cells aren't taking it up for some reason. And it can, kind of be a paradox there of where it actually means your body's actually deficient in B12, even though you have a bunch in your bloodstream. So folate, this is another B vitamin. You can see mine's just right there below optimal. I'd like to see that up a little higher. Interesting that the B12 is so high and the folate is slightly below optimal. I wasn't taking a whole lot of B12 or folate when I was doing the blood work, so that wouldn't explain why the B12 was so high. I may need to supplement with a little bit more folate there to get that number up. Because if that continues to get low, that can also lead to an anemia type situation. Hormones, so we'll talk about testosterone here. So total testosterone just slightly below the optimal range here. Same thing with free testosterone, so they're just both slightly below optimal. I'd like to see that up a little bit higher. So there could be a few things going on with that. Again, that could have to do with some of the things I have going on with the chronic infection or a stress thing, or sleep is very important for testosterone as well, and I haven't been sleeping well because of whatever's going on, so that could be affecting that. Sex hormone binding globulin. So this is we talked about globulin being a protein in the blood. It's kind of a binder. So this binds to testosterone. And so if you look at the total testosterone number and the free testosterone, so free testosterone would be what's not bound to this sex hormone binding globulin. That would be testosterone that's active that your body can actually use. This sex hormone binding globulin will bind to testosterone, basically not let your body use it. We'll click on this to see a little more. So produced primarily in the liver, transport molecule for carrying estrogen and testosterone around the body. So decreased, you can see I don't really have anything going on with metabolic syndrome or increased risk of cardiovascular disease based on my numbers. So again, it's just barely below the optimal range. Typically you would see this high with something like stress or increased abdominal fat, things like that can, metabolic issues can also cause that to be high. You're binding a lot of your testosterone. So some people will have normal total testosterone, but their free testosterone will be low because they have high levels of sex hormone binding globulin going on. Same thing with estrogen. I talked about it. Also, it's a transport for estrogen as well. So bioavailable testosterone, again, similar to the free testosterone, just below optimal there. percentage of bioavailable and free. You can see the percentage free is actually pretty good, but the other numbers are a little below optimal, so something probably need to work on there. All right, so the blood count here. So this is going over blood cells. So red blood cells here to start off with. My red blood cells are good on the optimal range. No sign of any kind of anemia or anything going on. Hemoglobin is slightly above optimal there, pretty close to the optimal range. Hematocrit, so that's the percentage of red blood cells. Again, just at the high end of optimal there. So pretty good with the red blood cells. No sign of any kind of anemia or anything from there. This is mean corpuscular volume. So this is the average volume of your single red blood cells. So this number, if we look at that, that can be an indicator of what type of anemia you have. Typically, if you have an iron deficiency anemia, that's going to be low. So it's considered a microcytic anemia. If that's high, that's more of an indicator of possibly like a B12 or folate deficiency anemia. So you can see I was a little low on folate, and we know I had the B12 situation, so that's what could be causing that to be a little higher than normal. MCH, so these are, in MCHC, these are mean corpuscular hemoglobin and hemoglobin concentration. So again, these can be an issue if there's an anemia or anything like that. Typically with like an iron deficiency anemia, these would be low. Same thing we talked about, with B12 or folate, they could be normal or high. You see my hemoglobin concentration there in the red blood cells is a little below optimal, but not too bad. Platelets, so these are the main clotting cells in your body, but they also indicate some other things. Can indicate some things about vascular health. If they're decreased, that can be associated with oxidative stress, infections, even things like toxins like heavy metals can actually cause that to go down. So platelets do more than just clotting. They can be indicators of some inflammation and immune system things as well. So you can see mine is just in the optimal range. It's starting to push toward below optimal, but I think that's pretty good in that optimal range there. So RDW is the variation in your red blood cell size. So this can indicate different types of anemia and things as well. Mine's slightly above optimal, just barely above the optimal range, so not too worried about that. Here's the white blood cells. So my total white blood cells are pretty good there, about 5.4, which is a little higher than usual, so that's good. Sometimes that can be down around 4 for me, so I'm a little more into the optimal range, which is good. So neutrophils, this is the percentage. You can see it's about 60% neutrophils, and that's one type of your white blood cells. Just right at the high end of the optimal range, almost above optimal, so just right there at the high end. So if neutrophils are high, that often indicates some type of bacterial infection. So that's where we would look out with neutrophils. If there's a viral infection, that can shift more to lymphocytes and causes neutrophils to go low, particularly like in an acute viral infection. In a chronic viral infection, that can be different. That can cause some issues with high neutrophils as well. But that's typically if we see high neutrophils, we think a bacterial infection. If we see low, we're typically looking at some kind of acute viral infection. Immature granulocytes, so that is going to be if there's some kind of acute infection or inflammation, that might make that go up. So those are basically precursors to some of the other white blood cells. If we see those around, again, that's probably going to be some type of acute inflammation or infection issue. Lymphocytes, which we talked about a little bit. So lymphocytes in like an acute viral situation are probably going to go up. But in a later stage of an infection or something like that, they'll come down, or some kind of acute bacterial infection when it shifts more toward neutrophils. You can see those are below optimal. You can see what it says about that, but decreased may indicate presence of a fatigued immune response, often seen in a chronic viral infection when the body's used up a lot of lymphocytes there. So again, another indicator that it could have some kind of chronic viral reactivation going on. Monocytes are another type of white blood cell. Can be affected by infections and things like that. So that may be high in a situation with parasitic infection or some other type of infection. You can see your levels tend to rise at the recovery phase of an infection or with chronic infection. It can also be an indicator of parasites like we were talking about. Eosinophils here. So you can see mine are definitely high at 9%. They don't want to see it above 3. So eosinophils typically indicate either some type of allergy or sensitivity. That could be an environmental allergy or a food sensitivity reaction going on, or a parasite infection. It can also, if potentially if you have asthma or something like that, that can go up as well. But typically, you're thinking some type of allergy or sensitivity or a parasite infection with the eosinophils being that high. So what I'm going to do with that is do an herbal parasite cleanse. And see if that brings that number down. If not, then I'll be thinking that's probably some type of food or environmental sensitivity. The good thing about like the herbal antimicrobials, like with the parasite cleanse for herbal, is that's going to have some crossover into viral and bacterial infections as well. So if I do have some other kind of chronic infection going on, like we talked about with the viral or possibly a Lyme flare-up, that would address that as well. So it'll be interesting to see. I'll do a parasite cleanse for about a month, and then we'll run this again and see if there's any improvement there. Basophils, so this is another number that can indicate parasites or allergies here. So you can see it's, mine's 1, so it's within range. You don't want to see that above 1 typically. But that's another white blood cell that can indicate an issue with parasites or allergies. Neutrophils, so this is the absolute numbers. We were talking about the percentages there before. So again, these kind of mirror the other one there. The absolute lymphocytes a little below, monocytes slightly above optimal, eosinophils definitely high. So the eosinophil number, definitely something I need to look at, and that's something that's actually been higher in the past on me. When I was dealing with mold exposure, that number actually went up to like 12 or 14 a couple times, which is really high. So it's come down a little bit to get to 9, but still an issue. So something's still going on there that I need to address. So definitely need to work on that, and we'll run this again after I do the parasite cleanse and see if there's been a change. So, all right, so that's the end of all the markers there. Again, it gives us a lot more information here. So this just gives us a breakdown of everything that was out of the optimal range, gives us an explanation. So when we click on those green boxes, this is what it takes you to down here. It gives you more of an explanation with that. So if we go through all that, down here. Okay, and so this has comparative ranges too, so you can see it goes through everything, says, yellow would be above or below optimal, greens in the optimal range, red would be outside the normal lab range, and you can see the alarm one here in kind of that purplish color. So there's a full breakdown for you like that. It'll also compare if you have previous tests that we've run in Optimal DX. It'll compare them side by side. Just give you some standard deviations on those numbers there. See what's farthest out of the standard deviation, everything. But if we go down here, it actually runs through some full assessments of different body symptoms. So you can see it goes through basically patterns in your blood work and gives you probabilities of where you may be seeing some dysfunction. So it's obviously saying liver and gallbladder based on some of those high liver enzymes and the bilirubin thing. Some of the thyroid stuff with the thyroid antibodies gives us some ideas of where there may be, possible dysfunctions going on. So that's pretty cool. It gives you a full breakdown of that. Talks about it here and why, their rationale for why they said that. So you can see the numbers that were high that went into that, why they would say that there's some dysfunction going on. So it gives you some accessory systems here as well too. So probability of some allergy or inflammation going on, that's probably due to the eosinophils is what they're banking on with that. The lipid panel being a little bit off. So again, it'll give you a full breakdown on that. Some nutritional, some nutrient status. So issues, maybe some fat absorption there, hydration, vitamins. It goes through all that, shows you where you might be deficient or have some issues with some nutrients there. Some like micronutrients here, so zinc and copper. It obviously says that I need folate, possibly, potential with the issues with the B12 and some of the other numbers. So pretty cool that it gives you all that and the explanation. So here's some more like clinical dysfunction. So they're, again, suggesting potential liver dysfunction based on the numbers there, gallbladder, biliary insufficiency, parasites. So that's based on the eosinophils being high. They're saying there could be an issue with parasites. Some of these other things here you can see gives you the percentage of what they would estimate there's dysfunction going on. So that's cool that they give you all that. and again, the explanations for everything and why they have that. And they also say, you consider running, some of these other tests in the future, the things that I, didn't run in this test. So you can see, gives you an idea of other tests that you can run to give you more information on whether there's actually, an issue going on there. So this, again, just health concerns, potential of that. Again, the liver's the main thing that they're showing me there. So you can see all the numbers. Further testing, so they have recommendations for other things we can run to give us more information. And the bottom's just the appendix. So again, this will give you some ideas of why some potential reasons why some of those numbers are off. Possible explanations for the numbers that are out of range there. So a lot of information from that. So you can see we go all the way down here. Yeah, so a lot to look at here. So and then the disclaimers and everything at the bottom. So yeah, very thorough report. So if you get blood work done with us as a patient, we'll run it through this report, and it'll give us an idea of not just the standard lab ranges, but where there's things that are above or below optimal, where some dysfunction is starting, so we can address that and before it gets to be full-blown disease. So as far as my blood work goes, I'm going to do the parasite cleanse, work on some antimicrobial therapy to address the infections, and after a month of that, we'll rerun the blood work at some point and see if that helped with the eosinophil levels and some of the liver enzymes. The main things that were an issue were the liver enzymes and the high B12 and the eosinophils. So that's what I really need to work on addressing, making sure I'm getting proper nutrients in my body, through diet and supplementation, and then addressing, what appears to be a chronic infection or a reactivation of a previous viral or bacterial infection. So hope you guys enjoyed that, kind of nerding out on some blood work there. So that'll be good, and to give you kind of an idea of how we approach blood work in functional medicine and what you can expect if you're a patient. So hope you guys have a great day. I'll see you in the next video.